Hey, everybody, and welcome to Rewired, a podcast put on by the Neural Connection Clinic in Edina, Minnesota. We are your resident nerds. I am Dr. Erik Reis, for those of you who haven't met me before, and this is Dr. Michael Hennes, one of my business partners and colleagues. Since this is a relatively new platform and podcast we're putting out, we just wanted to start off with some super brief introductions. So, Dr. Hennes, would you like to take it away and tell the people all about yourself?
Sure. My name is Dr. Michael Hennes. I am a chiropractic neurologist. I've been doing this a long time. I got into it because of concussions. I thought they were cool and I wanted to help a lot of people. And I've been doing that a long time. Besides that, I got 2 kids, married, live in the metro here, and just going for it.
Love it. Awesome. And for those of you who don't know me, my name is Dr. Erik Reis. I'm also a chiropractic neurologist. I've been in practice over a decade now, Mike, which ages us and dates us a little bit, but it is for better for worse. And we are both just excited to be here. One of the biggest things that we hold really true to our heart is that we are not only patients first, unfortunately, for better for worse, but we're doctors second. And now what we're really trying to be is advocates third. And the reason for putting out this podcast is to share the clinical gems, the tools, the knowledge, and the experience that we bring to the table to hopefully just help people help themselves, right? Now, whether that manifests as people being able to take care of themselves, having better questions for their doctors, coming in to see us, to be fair, we really don't care. We just want to be able to help people understand what's going on with them and really bring this knowledge to the forefront to hopefully improve their quality of life. So today's topic is near and dear to both of us. We've both worked with a ton of patients in this space, and it's talking about anxiety, anxiousness, and really when people struggle with autonomic function. The first question people should be asking is, what is autonomic function? Mike, do you want to go ahead and just kind of give people just a bit of a better sense of what the autonomics actually do?
Sure. Yeah, it's funny you say we've been doing it a long time and it dates us because as far as it goes, we're almost the old guys in the profession now. We're at least middle-aged. But yeah, so the nervous system can be broken up into 2 really basic parts. There's the part that you think about doing. You want to pick up a pen or something like that. Your brain sends a signal down and you grab that pen and pick it up. Then there's the autonomic system, which is the part that you don't think about, but it just keeps going. It beats your heart. It controls your blood pressure. It controls your heart rate. It controls your body temperature and pretty much everything in between. It never quits, but it does need some checks and balances. So what we're starting to see here is that there's an imbalance between the sympathetic system, the part that gets you all excited because you have to run away or you have to fight or something like that, and then the resting or the parasympathetic system. So when we have dysfunction of the autonomic system, there's some imbalance between those 2 different aspects of it. So that's the autonomic system kind of in a nutshell.
Yeah, I think when patients kind of start digging into this, they're like, well, gosh, I never really have to process balancing my blood pressure or looking at my heart rate or gut function. But unfortunately, these are things that are commonly affected, especially with concussions and TBIs. Now we see it in migraine patients, we see it with people who are in chronic pain, but it's really these background automatic things that are going on and that you never really have to think about until you do. Right now,
You never think about them until something goes wrong, and then you feel it all the time, right? If you're getting palpitations, you kind of give a pause, and you're like, what's going on there? If you're short of breath, or you start getting hot flashes, or any of those things, again, you wouldn't ever think about your body temperature until you're sweating and it's -30 out. For those of us that live around here,
exactly. Well, Mike, you've had these patients too, though, right? Where people will come in and they're like, I got a head injury or I got a concussion and yeah, my neck hurts and yeah, I'm dizzy or I'm feeling off, but my stomach feels weird or I'm having heartburn now. I mean, I can't tell you how often I've heard that. And they're like, these are just kind of separate conditions. And I'm like, well, hold the phone quick. We actually know that the autonomic or automatic processes in the background can be affected. So it's not crazy to think about that. The data is quite rife with it. It's just people don't really know or understand that.
Yeah, I think the 2 that get overlooked the most, like you said, are 1, indigestion, but then IBS on the pun intended here, I guess, the back end. Is I got IBS a couple months after my head injury, concussion, whatever it was, because I don't have, what they don't know is I don't have enough stomach acid to digest my food. So that irritates my guts and my body wants to get rid of it as fast as it can. The other one is getting dizzy when you stand up, right? Everyone says, well, I've been sitting a while. It's pretty normal to get dizzy when I stand. I give people 1 pass a day. First thing in the morning, you get out of bed. If you're a little bit dizzy, fine. I'll give you that one. Any other time of day, you better be super dehydrated or something's not right in your brain. You're just not controlling that blood pressure the right way. You really shouldn't get dizzy when you stand. I think those are probably the 2 that get overlooked the most, the IBS and the dizzy when they're standing.
Yeah, I think the way I quit it for patients is those things are common, but they're not normal, right? It's like diabetes, It's like obesity, it's like cancer. It's common today, but that doesn't mean it's normal. And so we see this all the time with patients where they're coming in and they're saying that they're dizzy, they're lightheaded, even brain fog. For me, that's like a lack of perfusion to the brain, or a visual dysfunction, or something else
perfusion
going
is your
on.
ability to move blood flow around to where it needs to be, for anybody that wasn't sure.
Yeah. So I think that there's so many aspects to this. So clinically, Mike, like when you have a patient come in with those symptoms, any approaches that you take, any kind of gems you can kind of throw out there, any approaches that you think are worthy of people trying at home that you've given to patients where you've seen some success? And everyone's different, obviously, but are there things that you usually go after or try that usually can help people in that situation?
Yeah, I always touch on them because I think one of the things that's lost in modern healthcare is everyone assuming that the basics have been covered. So I at least want to touch on these things. And the first is sleep. Sleep's a superpower. It's our human superpower, but it's overrated, maybe underrated is the better way to put it, especially in the US. If you're not sleeping, your autonomics are going to suffer. So making sure that you're getting good sleep. Now, if you're getting terrible sleep because your autonomics are messed up, all right, I get it. That is, you can cause one with the other. But looking at sleep for one, looking at hydration, looking at nutritional status, making sure you've got some of those basics covered. Again, a lot of people, a lot of healthcare providers assume that someone else has looked at these things, and I find that they're really not. Beyond that is figuring out exactly where the autonomic system is failing. So again, is it that blood pressure? Is it just the heart rate? Is it digestion? Which part of it is failing? And then in our exam, is there a particular part of the brain that if I poke and prod it and make it, do its job really, really hard, does that cause the autonomic system to fail? So I can kind of figure out what the cause or effect there is as well.
Yeah. Yeah, really well stated. The basics are so underappreciated, and there are so many assumptions that we make in healthcare. I think that there's nothing that will ever replace the basics in general. One of the things I usually start with is belly breathing, or just breathing in general. What are breathing mechanics? Or do they work well? Are you like hyperventilating at times? Are you overusing your neck muscles? I usually find that's a really safe way to kind of start people doing autonomic or lower brain kind of therapies when we start doing that. And so if we can if we have to rebuild the house, the first thing you'd always would do is check the foundation. It's kind of a foundational element for us, right? If you stop breathing, you're not going to live for very long. I mean, there's not much science that's going to refute that. But you're right. Like looking at the basics, sleep, managing just food, dietary intake, all those things are important. And I think most people kind of just forget to do that. So I think that's a really key aspect. Is there anything during your clinical exam that you notice with these patients where you're like, yep, this gives me conviction that these people are struggling with this autonomic or automatic dysfunction, and or you can kind of justify why they're feeling the way that they're feeling?
Sure. There's a couple things we do right off the bat is when we're taking our vitals. One, I want to make sure that something like your blood pressure is equal on both sides. Beyond that, we're taking a pulse oximeter. A pulse oximeter is a fancy little tool that measures your heart rate and then how much oxygen's in your blood. If it seems like you're using too much oxygen, so that percentage is low, or your heart rate is fluctuating way up and down, even though we're just sitting there, maybe talking, right? But if you're having a 20, 30 point swing in that conversation, unless I get the sense that you've got some PTSD about something, it means you're not regulating that heart rate very well. It's a heart rate variability, kind of a quick and dirty way to measure that. Beyond that, then we'll start testing blood pressure sitting to standing. Can you maintain your blood pressure while you're changing position? So some simple stuff like that. Otherwise, if they're really fidgety or just can't really sit still, they're constantly looking around, maybe there's some quote unquote white coat anxiety, even though we don't wear white coats. People get nervous coming to doctors, so I get that. And then on our VNG, the other thing I'll look at is if they just can't keep their eyes still. They're just constantly looking around, even though there's something to look at, right? It's a test we do in the office where there's a dot on a screen, you watch it move back and forth. Very exciting stuff, but it gives us great information. But if they can't even look at that dot, it means their brain is just all over the place and there's probably some kind of anxiety going on. That can be autonomic in nature. It might just be true anxiety or some of the other stuff we alluded to earlier.
Yeah, those are all great findings. And to be fair, there's so many ways to evaluate the autonomics, these automatics in the background. And so we have our tools, we have ways to assess it. I think more importantly, too, we have ways that we enjoy using treatment and treating it, right? So and we alluded to that a little bit. So, Mike, is there anything that you would leave people with who are maybe still struggling with symptoms, or they just got a concussion, or there's somebody who deals with a chronic migraine? They've gone to docs, they've done some therapies, and they're like, listen, I'm still having symptoms. Is there any advice or suggestions or support you can offer?
Yeah, I mean, it's kind of the same thing we say with concussions in general. It's like you can't give up just because you've gotten to the point where your doctor doesn't have any more solutions for you. It just means that you've exhausted that provider's knowledge. I don't pretend to be an expert in everything. The most powerful words I use with patients is I don't know. Right? It's important to say what you don't know. And if you don't, that's why we work together, right? We've got the three of us working together. We all have different skill sets, and then we have our network. So being able to refer out. But just because you're maybe getting told that your symptoms aren't real or you're not getting the attention that you feel like you need, it might just mean that you've exhausted that doctor's knowledge and maybe you have to go get another opinion somewhere. Hopefully that is supported by your provider, but if it's not, don't be afraid to go and look elsewhere.
Yeah. No, that's great advice. That's phenomenal advice. And worst case scenario, we offer free consultations as well too, right? So we're always taking calls from people. A lot of times we're not the right fit. We'll put them somewhere else. We'll send them to another doctor, but there's always an opportunity to have a free conversation and pick our brains. So for those of you who are just joining us, thank you for supporting this platform, this program. We have all of our contact information in the description below this YouTube video, and we'll be putting out more of these every week. Your feedback matters. We're open to suggestions, and more importantly too, hopefully you can take something away and make your life a little bit easier. So once again, we are the doctors at the Neural Connection. This is Rewired, a Rewired podcast, and we're looking forward to seeing you again at the next